Ministry of Public Health of Ukraine. Krok 1. Medicine. Year 2018. Number 052. Coronary artery thrombosis resulted in development of myocardial infarction. What mechanisms of cell damage are leading in this disease? A. Protein. B. Electroosmotic. C. Acidotic. D. Lipid. E. Calcium. Cardiac ischemia causes a rapid decline in mechanical performance and, if prolonged, myocardial cell death occurs on reperfusion. Intracellular calcium rises during ischemia, and that the early decline in mechanical performance is caused largely by the inhibitory effects of phosphate and protons on the myofibrillar proteins. The rise of intracellular calcium during ischemia is related to the acidosis and is probably caused by calcium influx on the Na plus Ca2 plus exchanger. This is triggered by a rise in intracellular sodium, which enter the cell in exchange for protons on the Na plus H plus exchanger. Intracellular calcium rises still further on reperfusion, and the elevation of calcium and the degree of muscle damage are closely correlated. Intracellular calcium accumulation was the pivotal event in the transition from reversible to irreversible ischemic myocardial injury. The influx of calcium, abrupt increase in cytosolic calcium concentration, leads to contraction band necrosis. Contraction band necrosis is a type of necrosis unique to cardiac myocytes and thought to arise in reperfusion from hypercontraction, which results in sarcolemmal rupture. It is a characteristic histologic finding of myocardial infarction that was partially reperfused. Reperfusion injury, ischemia. Reperfusion injury, reoxygenation injury, is the tissue damage caused when blood supply returns to tissue after a period of ischemia or lack of oxygen. The absence of oxygen and nutrients from blood during the ischemic period creates a condition in which the restoration of circulation results in inflammation and oxidative damage through the induction of oxidative stress rather than, or along with, restoration of normal function. The answer is E. Calcium.